Imagine a baby being delivered at the hospital. Everything might have been going smoothly until suddenly there's an accident. Fractures due to shoulder dystocia, bruising from the use of forceps or vacuum extraction, a fall right after delivery, an explosion, or even a fire in the delivery room. Or perhaps the baby is delivered safely, goes home, and later, while exploring, slips on the stairs or touches a hot object during a brief moment when no one is watching and gets burned. This is a way to understand the difference between leukemia and lymphoma. If the baby's injury happens at the hospital, injury that affects them later in life, it represents a problem that starts in the delivery room. This is leukemia, where the issue begins in the delivery room of blood cells, the bone marrow. Now imagine the baby makes it home safely. One day, while crawling around, they fall from the stairs and get hurt. Over time, this injury causes lasting effects like low self-esteem. Child grows up to become a villain. This reflects a problem that starts after leaving the delivery room. That's lymphoma, where the issue begins in the lymph nodes, not in the bone marrow. Just like the type of injury depends on where it happens, leukemia and lymphoma have different mechanisms. Injuries in the hospital might involve birth complications, sharp objects, or rare falls. Injuries at home, however, could involve burns, falls, or accidents specific to that environment. Similarly, their symptoms differ. Leukemia often presents with systemic symptoms like fatigue, frequent infections, easy bruising, or bleeding due to low blood cell counts. Lymphoma, on the other hand, typically presents as painless, swollen lymph nodes in areas like the neck, armpits, or groin, along with fever, night sweats, and unintended weight loss (B) symptoms. The people involved also vary. In the hospital, it might be a nurse or doctor involved in the baby's injury. Just like leukemia affects all white blood cell lines, at home it could be a parent or sibling, much like lymphoma primarily affects lymphocytes. Same way the genetic mutations in leukemia and lymphoma differ because their environments of origin differs, the bone marrow for leukemia and the lymph nodes for lymphoma are distinct. There's also a difference in maturity. A newborn in the hospital is younger, just as leukemia typically affects immature cells in the bone marrow. At home, an older baby might face injuries, just as lymphoma involves mature B and T lymphocytes in the lymphatic system. Of course, overlaps can happen. A mother in the hospital might accidentally hurt her baby. Just like lymphoma can sometimes involve the blood and bone marrow. Similarly, a healthcare provider can make mistake with the take-home prescriptions and hurt the baby at home, just like leukemia can spread to the lymph nodes. Life is unpredictable, and so are these diseases. But understanding where the problem starts helps us better appreciate their differences. And that's why this channel is here to simplify those outrageously boring and complicated medical knowledge and make your mastery journey easy. So don't forget to like, share, and subscribe, as more videos of simplified concepts are going to be dropping on the channel